Hello everyone, my name is Ola Dayamomo. I preferably go by Daya. Today we'll be talking about pituitary adrenal disorders. The first thing that comes to mind as a healthcare worker about adrenal disorders are Cushing syndrome, where you see a moon phase, striae, and many other signs and symptoms. I also think of Addison's disease and, acromegaly and the likes. But for my non-healthcare workers, let's dive in. Excuse me. So let's talk about the pathophysiology of Cushing syndrome and what really causes it, right? Well, when it's stimulated by the ACTH, the adrenal gland secretes cortisol and other steroid hormones. So the switch that controls that feedback mechanism is called cortisol, which cortisol is the hormone that controls our stress level. So when the levels are low, when the levels of cortisol are low, the system turns on. And when they're high, the system turns off. However, excessive use of steroids leads to excess free circulation of cortisol in the body, which also along the line increases the anti-inflammatory effects and lowers the body's ability to protect itself. Now let's talk about Addison's disease pathophysiology. To shorten this as much as we can, it's pretty much caused by damage to your adrenal glands, which results in not enough of the hormone cortisol, also dealing with the cortisol again. So there's not enough home of that cortisol and not enough of the aldosterone as well. So your adrenal glands are part of the endocrine system. We all know that. They produce hormones that give instructions to virtually every organ and tissue in your body. So these are the signs and symptoms that you may experience when you have Addison's disease and Cushing syndrome. So the common symptoms you see in Addison's disease, you see a bronze pigmentation of the skin, changes in the distribution of body hair. So the hair in your body is not evenly distributed. You have some GI disturbances, so like vomiting, diarrhea, nausea, and you have generalized weakness all over your body. You also have weight loss and postural hypotension. So you might find to have some lab issues, some electrolyte issues as well. So some sugar issues also. So we have hypoglycemia. So when a patient goes through an adrenal crisis, they tend to have electrolyte imbalances. So therefore, they have a decreased number of sodium and vice versa, an increase of potassium. And they also suffer from profound fatigue and dehydration. Now, let's talk about Cushing syndrome. I said earlier that you tend to experience the moon face, right? You see the striae, the stretch marks, that's what those are called. And you see personality changes as well. For the males, they tend to have gynecomastia, which is like breast. They develop those things. They have fat deposits on their face and the back of their shoulders. They tend to have patients with Cushing syndrome tend to suffer with osteoporosis, thin skin, bruises. They're very prone to bruises and petechiae. And females, especially, they suffer with hemonia, which pretty much means a cessation of menstrual periods. They also suffer with GI distress as well, and the GI is pretty much very acidic. They tend to have thin extremities. Excuse me. And they also suffer with electrolyte imbalances. So the sodium in the fluid, they're retaining sodium in fluid, so that causes edema. And they also have hypoglycemia. And of course, the central nervous system irritability. Now, what tests can be done with Cushing syndrome? So you have urine and blood tests, and pretty much this urine test they measure the hormone levels of urine and blood. and shows whether you're producing that excessive cortisol, right? This again is for Cushing syndrome. So for imaging tests, you see a CT, you have to do a CT and an MRI. And this pretty much allows us to see the images of your pituitary and adrenal glands to detect any abnormalities there, such as tumors. Purchasal sinus sampling as well. This test can help determine whether the cause of the endogenous Cushing syndrome is rooted in the pituitary or somewhere else. Sorry. Addison's disease, the diagnostic test that we do here, includes blood tests. And pretty much we're checking the levels of the sodium, your potassium, the cortisol, the ACTH, which is the adrenocorticotropic hormone. All this stimulates the adrenal cortex to produce this hormone. So we're checking for those things in there in your blood. We also do an ACTH stimulation test, and that signals your adrenal glands to produce cortisol, which this says pretty much measures the level of cortisol in your blood again. And we do a insulin test, a blood sugar test, right? As well as imaging test, which of course we do a CT scan or MRI to check your adrenal glands and look for any abnormalities that are there. The long effects of glucocorticoids, which are steroids, right? What causes this? What long-term effects can this steroids have in your body? So let me tell you. It can cause osteoporosis, which is very well known. And apparently about up to 40% of patients on long-term glucocorticoids develop a bone loss, which leads to fractures. It can also cause a loss of muscle tissue, which results in Cushing syndrome, which can lead to the fatty hump between your shoulders. All this play hand in hand. It also causes an increased risk of infections and even cataracts as well. So watch out for that. Now let's talk about the growth hormone disorders. So we have dwarfism and acromegaly. So what is it called? What's dwarfism caused? What causes it? It's pretty much the pituitary tumor or failure of the pituitary to develop. Infection trauma, also neglect or severe emotional stress or malnutrition can cause dwarfism. Now, signs and symptoms of dwarfism. Pretty much, the term dwarfism just pretty much means a very short person, right? So they grow to only about 3 to 4 feet. That's the max. They have a slow sexual maturation. Children tend to suffer from mental retardation. Adults, they suffer from weakness, hypoglycemia, sexual dysfunction, skin changes, and increased risk for cardiovascular and cerebrovascular diseases. Now, acromegaly, which is a bit different from dwarfism, also affected by the pituitary gland. So you see a pituitary hyperplasia, a benign pituitary tumor as well, and an hypothalamic dysfunction. So the signs and symptoms you may experience are your nose, jaw, brow, hands, and feet are enlarged. Your tongue becomes thick. You have visual disturbances, headaches, erectile dysfunction, and once again, a cessation of menstrual period. Now, gigantism. This is when you grow extra, extra tall, too tall. Complete opposite of dwarfism, right? So this is caused by an overproduction of the growth hormone, which causes you to grow too much. In children, the condition is called gigantism. In adults, it's called acromegaly. So complete opposite. So acromegaly is for children. For adults, we call it gigantism. I don't even know if I'm saying that right. So, however, so it's an excessive growth hormone, which is almost always caused by a non-cancerous pituitary tumor. So all this, what they have in common is that there's a pituitary tumor. So once again, the pituitary gland is affected. Children tend to develop great stature, and adults develop deformed bones but do not grow taller. They tend to develop heart failure, weakness, and vision problems are common. The diagnosis is based on blood tests and imaging of the skull and hands. CT is also done, computer tomography or MRI of the head are done to look for the cause. So that's pretty much the end of it. I hope you were able to gain one or two knowledge or wisdom about adrenal disorders that affect the pituitary gland. These are my references. Thank you and have a wonderful night.